I'm a cancer survivor.
Hi, my name is Kelly Barnes, and this is my little survivor here, Daniel. And we're here to let you know that we're still alive and kicking. Daniel was diagnosed with malignant astrocytoma January 30th of 2002, and he was about a month being out of 3 years old, and we were told that he would never see his 8th birthday, but he made it, and we're here to tell you that the Poly works, and he's a living miracle of that. We did start off with traditional medicine. We had a 6-hour brain surgery, which got 18% out, and then they wanted to do a weekly chemo for 3 years, and after about 5, he was so sick, I didn't really believe that he would live through that. And then we were introduced to the Poly MVA, thank goodness. So he's been on Poly for 5 years and 2 months tomorrow, and we're here to tell you that it works. We believe in it 1,000%. Just to let you know, too, with the Poly, we have gotten reports that his tumor is stable, but not only stable, it's actually shrunk on 4 different occasions in the last 5 years. And we're here to tell you that I'm looking forward to the high school graduation and the wedding and the grandkids and everything.
I am a cancer survivor. I'm Mike Muscari. I'm from Birmingham, Alabama. At age 49 in 2002, September, I had my diagnosis of prostate cancer, and my Gleason score was 6, 3 plus 3. I had about a 2.8 PSA, and at that point I determined that I would begin a protocol of just a very disciplined reduction in my diet, doing some smart things about eating well, drinking water, all the things that you would expect that somebody in this circumstance would decide to do. And within the ongoing 9 months up until September of 2003, all of my testing revealed that the prostate cancer was increasing and growing. So in June of 2003, I had a 6.3 PSA, and my oncologist suggested that I go and look into a trial that was occurring in San Francisco, which I did. And subsequent to that, I came back from that really encouraged and began a protocol of utilizing Poly MVA. On the 4th of July of 2003, I started taking Poly MVA in earnest. On the 10th of July, I had a PSA test, and my PSA had dropped from 6.3 in early June to 4.6. Well, in my particular opinion, I was excited about that because that's roughly a 25% reduction in my cancer numbers. Having said that, give you a little background on my history. My father died of prostate cancer at the age of 73. My mother's father died of prostate cancer at the age of 65. So therefore I had men on both sides of my family that were prostate cancer victims, if you will. And my mother, in fact, passed away this year, 2007, of breast cancer that had metastasized to bone cancer. So our family is not without a significant history of dealing with cancer. But I would recommend to anyone that they start a very rigorous protocol of Poly MVA, be very disciplined, and track your numbers. There's no reason as a prostate cancer survivor that I cannot have and order a PSA test fairly much as frequently as I would like. And by having access to those numbers gives you a sense of how the progression of things is going. So if you, like myself, have been diagnosed with cancer, I certainly encourage you immediately, go to the website, review the information, start a protocol with Poly MVA right away. I'm living proof that Poly MVA has certainly worked to my benefit and has helped me win against the scourge of the cancer.
I've become a true believer because I feel that this food supplement, Poly MVA, has definitely demonstrated in a statistically relevant clinical study where careful records were kept on all of our patients, and outcome-based data showed unequivocally and verifiably that this substance is both compatible with standard chemotherapy in conventional or low-dose form, and it stands alone in patients who do not want chemotherapy, but who want the advantage of a natural supplement, which is helpful in ridding their bodies of cancer.
I have a patient down in Fort Myers, Florida, whose name is Mary. She had glioblastoma multiforme, which is a very serious brain cancer. She had 6 tumors the size of golf balls in her brain. It had rendered Mary immobile. She was confined to a wheelchair. She went totally blind. She was unable to take nourishment. And for all intents and purposes, the family was getting ready to have her funeral. We began her on a full program, which included as a main center point of her therapy the Poly MVA. Within a 2-week time period, Mary was out of the wheelchair, ambulatory, taking nourishment. Her vision had returned, and her oncologist spoke with our offices, and he just could not believe that this had happened. And this is a traditional allopathic oncological physician. He said he could not believe it, but it was believable because we saw the MRI. The tumors were nowhere to be seen, and Mary has been cancer-free now probably 10 years.
My name is Dr. Albert Sanchez, and today you have been privileged to hear a lot of testimonies that are not only genuine, but they're very, very real. And you heard from some doctors. We really could have put this film together with hundreds of testimonies and hundreds of doctors that are using the Poly, but no one would ever sit through listening to all the beautiful testimonies that we have. I want to end this particular talk with urging you that you too can be a survivor just like the people that you listen to today. Please access our website, access our emails, and we will send you everything you need to know in order to make the most intelligent decision affecting you.